And welcome to Diplomatic Passport, your COVID-19 daily show. And this program is brought to you by ZTN in partnership with the Ministry of Information, Publicity and Broadcasting Services. My name is Blessing Manase. Let's take a look at the statistics released by the Ministry of Health and Childcare yesterday. We had 130 new cases of COVID-19, which were recorded from 4,063 COVID tests that were conducted. This, of course, represents a positivity rate of 3.2%, taking the number of active cases to 2,807. 5 deaths were recorded, bringing the cumulative fatalities to 4,535, and the cumulative number of COVID cases now stands at 126,399. Of these, 119 and 49 are recoveries. So Zimbabwe making that slight shift. We are seeing the downward trend in as far as the COVID-19 cases are concerned. Remember, in mid-July, we were doing between 2,000 and 2,500, topping with a number of 3,110 in the third week of July. We moved to around 1,000 in the last week of July. Before, we were doing around 600 to 700 cases daily. That's in mid-August. So the cases have now gone down to just over 100 per day, with single-digit deaths being recorded. Now, Zimbabwe currently has 136 hospitalized cases of COVID-19, and of these, 5 are new admissions, 24 are asymptomatic, 85 are mild to moderate cases. 25 of those admitted have severe symptoms, while only 2 are in the intensive care unit. Now, if we look at the figures in Africa, looking at the CDC, Africa CDC figures that were released yesterday, 8,052,110 total cases have been recorded in Africa, and of those, deaths that resulted in deaths are 204,025 deaths that were recorded, while recoveries stand at 7.3 million. This, of course, represents a mortality rate of 2.5%. That is for the global reach, and the recovery percentage looking at Africa is just at 91%. So Zimbabwe recovery rate is just slightly above the African average of 91. We are on 94%, but when it comes to the mortality rate, we are slightly above 3.5%. And of course, this compares with the global average, which is 2 to 3%. Now let's move on to Zimbabwe's ongoing vaccination program. 11,807 people received their first dose yesterday, bringing the cumulative for the first dose to 2.8 million, and 31,644 received their second dose, bringing the cumulative for the second dose to 1.894 million. Looking at the vaccination figures that we have, we now know that more than 31% of Zimbabwe's population has been jabbed, and this is, of course, in line with Zimbabwe's ongoing program. That's a vaccination campaign that is ongoing. And still with that, today, Zimbabwe received a further 1 million doses of COVID-19 vaccines. This is the Sinovac rather, because we did receive 1.5 million of Sinopharm between Friday, Saturday and Sunday. And this brings to 2.5 the number of doses that we've received over this weekend. And it brings also the cumulative for the country to just over 10 million that we have received. And this is Zimbabwe's ongoing vaccination campaign, and it is in tandem with the government's drive of introducing the vaccines also to the vulnerable groups. We heard through cabinet that government will be extending the vaccination to the teenagers to cover the 14 to the 17-year-old range in as far as vaccinations are concerned. And Professor Solwayo Ngwenya, who is the CEO of Mpilo Hospital, we got in touch with him, and he was raising the issues that the youths, when it comes to the youth, the danger is that they do tend to handle the coronavirus in a much better way than us, the elderly people, would do, and this poses a danger of them propagating the resistance within their bodies and also exposing the vulnerable groups outside there. But let's hear what he had to say about the vulnerable groups.
Yes, we saw in earlier variants, children were just vectors moving around the virus without them falling sick. But now with the advent of this new Delta variant, which seems to attack almost even from neonates, we have seen neonates, we have seen children. So, and the studies that were done on the vaccinations were not done on children. They're only starting to conduct them now. So governments have been unable to vaccinate children. So, children also have to go to school, and so there's pressures from school. So we are facing a dilemma now of, if we open school, we are opening floodgates where we actually children are going to be infected, and we know this variant may even kill them. At the same time, you try and say you want them to go to school. So the Delta variant is really presenting a terrible situation in the global sense, in Zimbabwe and everywhere.
So the Delta variant is creeping into the adolescent groups, most certainly also the teenagers, and this makes this move by government to vaccinate also the teenagers from 14 to 17, lowering the minimum age requirement for vaccination from 18 to also include that group. But Zimbabwe's Deputy Minister of Health, that's Dr. Mangwiro, also highlighting that even as government goes down that route of ensuring that they vaccinate children, that's the teenagers, they will be taking a scientific approach, and that the country will first of all conduct clinical trials in order to ensure that the risks are well assessed before actual rollout of a vaccination into the teenagers. Let's hear what he has to say.
This is a population that the Medicines Control Authority set conditions which the ministry is already implementing. So once these vaccinations are there, the children are protected. And this age group that has been started, people sat down with pediatricians, MCAZ and scientists and us and all those, so that we do it safely. I told you and I repeat that we are led by science, and this is what we are doing. So when someone's 10 comes, please let the children get vaccinated. It's important because this is life-saving. The children are the future of the country. We want to safeguard against anyone losing life as a child. Any person for that matter should not lose life, because the vaccines are there. The government has bought them. Your job is to go and get vaccinated for free. I repeat, it's for free. And the children are the future of the country. Let's protect them, which the government has set out to do. I think.
Dr. Mangwiro, the government has done so well to address the supply side of issues. In terms of the decentralization strategy, is there any change that's happening? Where are we going now from here?
Decentralization of the vaccination program. No, it has always been there. Remember how our government operates, or the Ministry of Health operates. The vaccine has come now, it goes to the central stores. From the central stores, it will go to our central hospitals, which are 6, namely Harare, Chitungwiza, Parirenyatwa, Mpilo, Ingwicheni, and UBH. Then, from the central vaccine stores also, they go to our respective provincial centers or hospitals. Then from the provinces, each province, we have about 10 provincial hospitals. Each province then has got district hospitals. The whole country is about 63 district hospitals, where each province distributes to the district hospitals, and each district hospital in turn distributes to rural health centers, and rural health centers to village health centers. Also, we have invoked that private dealers are also hospitals, clinics, practitioners. All those people who are professionally trained to give injections are doing so. Also, we have also called those who have retired to come and help out. This is a national fight against a deadly disease. So we have called in everyone and everybody who can help out. So the decentralization is also enhanced by having outreach teams, those people who drive to go to shopping centers, churches, schools, wherever people can be. those who have got difficulties in walking or even will be approached by our mobile teams. So the decentralizing is quite massive. This is what we are doing as government to make sure that the vaccine gets to the last mile, to the last person. All we need is information as to where the difficulties are, and we'll be there. I thank
December,
you.
are we on track to meet
We definitely, as you can see, we have received 1.5 million now. By Sunday it will be 1. So we are on track. And this has gotten, our figures are now above 10 million. The government bought 12 million, and they have added more. Just wait and see. December, we're on track. Zimbabweans must just go out in their numbers to go and get vaccinated. I think.
Thank you, Dr. Mangwiro. Dr. Mangwiro, the Deputy Minister, Zimbabwe's Deputy Minister of Health and Childcare, giving us an exclusive on Zimbabwe's vaccination campaign today.
So that's Dr. Mangwiro, Zimbabwe's Deputy Minister of Health and Childcare, saying that we are on track to meet herd immunity, expressing confidence and, of course, the momentum that we have made as a country in as far as the vaccination campaign is concerned. The momentum looks like it's still there. Month to date for the month of September, it looks like we have already inoculated 533,000 people, which means by the end of September we should be able to breach the 1 million mark in as far as the inoculations that we are going to do for September. But we will, as Diplomatic Passport, be interrogating other factors around, especially the numbers of testing and also the vaccination numbers, which seem to have gone down slightly over the past 3-4 days. We will wait to see if this will be having any impact on the momentum that we currently have on the vaccination program. But this brings us to the end of today's show of Diplomatic Passport. We are back again tomorrow, giving you more insights around Zimbabwe's COVID-19 effort, as well as what's happening around the globe and also in Africa. This is a show that's brought to you by ZTN in partnership with the Ministry of Information, Publicity and Broadcasting Services. My name is Blessing Manazi. It has been an absolute pleasure. Do make a date with us tomorrow. We're back, same time. Goodbye.